So we're going to begin our research, our presentations with research conducted by the School of Nursing faculty and some research assistants and PhD students. Dr. Xiaomei Khan, Divya Ramesh, Mallory Perry, Catherine Bernier, Erin Young, and Angela Starkweather all conducted a research study entitled Self-Reported Pain, Pain Sensitivity, and Gut Microbiome Pattern in Young Adults with Irritable Bowel Syndrome. Their research reminds us that young adults are also burdened with chronic illness that stretches across the lifespan, and their research looks to uncover underlying mechanisms of pain associated with IBS. So please welcome Dr. Xiaomei Khan and your team.
Good morning, everyone. We are so honored to be invited to present our study here. This is Catherine, and we will present our study here. IBS is a chronic situation, and it's the prevalence is probably over 20% in worldwide, and in some kind of area probably more than 20%. The direct cost in the U.S. is really large, 21 billion per year, and the most distressful symptom is related to pain, and also the individual who has IBS, they have long time to learn how to manage, how to coping for this frustrating pain experience. So the purpose of this study, we likely get support from our P20, funded by the NIH, and Debbie is our new core director. Dr. Starkweather, she is the P20 Center director. So we try to develop a self-management protocol module to help the IBS participant to learn how to manage their pain and other IBS-related symptoms. Catherine will talk about our study design and data collection.
So this study was a randomized controlled longitudinal study. Our recruitment sample is for 80 patients from age 18 to 29 years old, and the intervention for the experimental group were 10 online interactive modules. That was for everyone. And then for the experimental group, they did one-on-one nurse consultations 3 times throughout the study, as well as self-evaluations. We set goals with them, and they also completed an online diary. The outcome measures, we looked at pain sensitivity, and how we measured that was through quantitative sensory testing. And that was a series of 7 tests where we induced pain and measured the sensitivity and thresholds of pain. There were also a number of questionnaires we looked at, including food intake, physical activity, medication usage, coping, and then quality of life, as well as a number of general health indicators. We also collected cheek swabs, as well as blood samples to look at pain sensitivity SNPs and gene expression. And lastly, we did collect stool samples to look at that gut microbiome. The procedures, it's a little bit hard to see this figure, but in the procedures, we started with recruitment, and those, I'm sure you all saw the flyers that went out and the daily blast to recruit for this IBS study. After someone called with interest to participate, we engaged in a phone screen with them to see if they were eligible. If they were, they would come into our study lab. We completed a formal consent process with them, and then they were randomized into either the intervention group or the control group. Both groups at that first study visit received, they performed the questionnaires with us, the quantitative sensory testing, and we obtained the blood samples and the buccal swabs. After that, we asked that the participants deliver their stool samples within 1 week of that first visit. After those samples were delivered, we sent out the video modules to all of the participants. And these, again, were 10 video modules that that reviewed things like IBS symptoms, pain sensitivity in IBS, as well as how to self-manage IBS symptoms better, such as how to do mindfulness meditation and recommendations for exercise. After those video modules were complete, we would contact the experimental patients to review the one-on-one nurse consultations. And there were 3 total consultations through the entire 12-week participation, and this was the first one. After that, both groups would come back for their 6-week follow-up, and then during that 6-week follow-up, we'd do the second consultation, and then everyone would come back again for the 12-week follow-up. The experimental group also completed daily diaries over the course of 35 days of their participation. The daily diaries would include collection on their pain levels, their symptoms, and any strategies they use to manage these symptoms. Our measurement, here's a list, so we collected really a range from demographics to quality of life to how people use self-regulation skills and exercise. And then, of course,
Yeah. So additional for questionnaire surveys, we collect clinical data and self-reported symptoms, and also we measure the pain sensitivity related genetic variations. So we call this SNP as a single nucleotide polymorphism. So we call the SNPs like your gene, like a specific kind of gene have like a variation, allele variation. So may kind of related to your pain. So we kind of select some specific kind of genes related to pain, and so use barcode swab sample and also blood sample. So the data we kind of run by Dr. Yang's lab and our P20 lab. Also, like we look at the gut microbiome pattern. That is also fun part. So we teach the participant how to collect their stool sample. You know, this young kind of adults, sometimes they feel, yuck, we don't know how to do that. And or how big size of the stool sample we need to put in the tube. It should not too big or too small, so like the pea size. So it's very fun. And so after we get the stool sample, we put in the sub-80 freezer, and one is ready for analysis. So we went to our UConn, we call the Mars facility. It's a microbiome lab. We do the DNA extraction from the stool sample and run the specific kind of gene of the microbiome, and to test this kind of part of the gene to look at what kind of the microbiome pattern for a special patient and special stool sample. This we just get our baseline data analyzed. So like you can talk about some like baseline data.
Sure. So for the baseline data, this data shows up to 72 participants that we recruited. I believe our recruitment is currently at 74 or 75. So the sample looked like they were average 20-year-old females on average, mostly Caucasian. And of course, we're recruiting here on UConn, so it's a lot. Most of the participants had some college. And then the years of IBS diagnosis ranged from around 2.8 plus or minus 2.6 years. For the PROMISE data, where we were collecting variables across the health spectrum, what's interesting here is the anxiety and cognition concerns. And if you think the average across the US is 50, with a standard deviation of plus or minus 10, the anxiety level is higher in this population, and the cognition concerns is lower in this population, which cognition involves concentration and general thinking. So when you think of college-age students, it's not surprising there. And then looking specifically at pain, how much body pain did you have during the past 4 weeks? If a healthy norm, higher number is less pain, well, you can see that this population has higher pain for the lower average. And for BPI scores, again, a general pain indicator where we're asking participants to rate their pain on the 0 to 10 numeric scale. This pain is shown to have this population has shown to have chronic pain and pain interference.
And also we have the QST, the quality of life for this group of young adults with IBS. So the higher is means high quality, and the lower score is means. So it's really we concern about their quality of life is their score is lower. So also the QST is the quantitative pain sensitivity testing. Like we have equipment and machine to look at like their response to hot or cold, like a pain stimulation, like how they respond, the threshold. So we find out compared to the healthy kind of control parameters. So this group of IBS patients, they have some different response to pain stimulation. So like mechanical pain sensitivity is higher, and also dynamic mechanical arrhythmia is also like higher, and also wind-up ratio is also higher. Means they may have, because they have this kind of chronic pain experience, their neural system, peripheral or central neural system, probably they have some adverse kind of or some alternative response to pain stimulation. And also we look at the SNPs. So these SNPs may related to pain, and especially these three kind of SNPs, we find out later. I will show you. So the patients with high allele of this gene probably have like different pain response. These three genes come, and the TNF and THR related to your inflammatory kind of process, your neurotransmitter level regulation response to pain. So these are kind of three kind of SNPs related to pain response. We look at the relationship. These are the baseline data still. We have not looked at 6 weeks and 12 weeks follow-up yet. So self-reported IBS pain related to their self-reported IBS quality of life, and also the global health, and also QST, and also related to the SNPs. And also BPI, that is pain sensitivity level, also related to these parameters. So when we look at the individual SNPs gene, we find out, so the, I don't know how to use this one. So the COM kind of gene, if the patient with AA allele, they respond lower pain compared to patients with GG allele. And so for patients, for the TNF SNP, so the patients with AA allele responds lower pain compared to the patients with GG alleles. So that is probably the genetic attribution related to your pain response. And also BPI interference related also, not only the sensitivity, also interference, how this pain kind of influence your life, or influence related to your distress or something. Also, like the HTR is the serotonin kind of neurotransmitter response. This gene also with CC allele patients and CT allele patients have a lower pain response. And also for TNF, also the patients with AA allele have less pain interference. So these are some kind of give us some idea, like a gene related to pain. And also do you remember we talked about microbiome pattern for kind of related to IBS pain. So first we look at gender difference. So male and female IBS patient, they have different pattern, and also diversity. So think about a microbiome community. They may have different type of phyla or order of microbiome. So if more evenness or even kind of more balanced microbiome, we call higher diversity. So you see like female have more diverse the pattern on your left is female, so have more diverse, and male have less diverse. And also if you look at the individual species or individual orders of the microbiome, so male have less abundance of Clostridia. So that is also probably tell us something, male and female have difference. And also when we look at, we think about, so why your microbiome patterns are different among different individuals, and also related to probably your IBS pain. It's also maybe related, so genetic, your host genetic variation may relate to your gut microbiome pattern. So that is, we look at, so the patients with GG allele compared to with AA allele, you will see the pattern are different. So for A allele patients, they have more diverse, and also the Clostridia kind of that portion is bigger than the GG allele. So that is just, it's very preliminary. We don't want to have any conclusion yet, but just try to look at your host gene related to gut microbiome. So this one also, another gene is TNF, is related to cytokine and inflammatory kind of receptors. So also like CC allele patients may have more diverse, and also compared to TT allele patients. Another gene is HTR is serotonin receptors. So also like you may see some difference, but it still is very preliminary results. So the conclusion of our study, so many factors influence chronic disease IBS. So including their health, their anxiety, depression, QST, SNP, SNP kind of genetic variations, and also gut microbiome patterns may related to IBS pain. So these factors need to be considered when we provide self-management pain intervention for this group. So the study recruitment is still ongoing, so I hope like every students and faculty can help us to recruit. And also like we hope next time we will look at 6 week and 12 weeks data. We want to see, so based on after the patients receive our intervention, their gut microbiome pattern may change. We hope they can like have some increased diversity, and also kind of influence their self-pain and also self-reported symptoms. So that is our study, and we really grateful, like have a lot of collaborations. We have UConn Stores campus, all the students help actually, and we have Health Center, GI Clinic, CCMC, GI Clinic, and hospital, Harvard Hospital, and also Eastern Connecticut State University. We have a collaborator over there, and also we have HIR collaborators. And also I have a really wonderful group of students, faculty help us, Angela and Aaron, and I have Kendra, she's in the lab, and also I have Divya, Wally, they are wonderful project managers. I have Catherine, Mallory, and I have our visiting scholar, and Jie, they doing like a lot of DNA extraction, play the stool samples. And I have wonderful undergrad and honor students, they help a lot as well. Tassa and Woodland, and also other students. And here's our pain center, the camp center, probably you will see. So anybody have interest in pain study, contact us. We will provide our support for you. Thank you very much.
Are you considering expanding your study to a population of older, late midlife adults?
That's a good question.
Just asking for a friend.
Yes. that is our probably the next step. We really want to look at the whole lifespan response and provide like a intervention.
I'll let my friend know.
Okay, thank you.
Anybody else?
Are you considering finding a different picture for our sector that doesn't look terrible?
Send me a good picture. Yes.
How can we help with recruitment?
It's a kind of like we really need help for our recruitment. So we have flyers, we send emails, but definitely next time we want to go to more target clinics and the GI clinics. If you have any contact, we really need help. Thank you very much.
Anybody else? All right, well, let's all give another.
Thank you very much.